Hello, welcome to Sanofi's Insulin City, the world's largest insulin production site in Frankfurt, Germany. I'm Dr. Nikolai Kane. I am the engineer responsible for this shift, and I am here to guide you on our tour. I hope you will like it. During the next minutes, we would like to take you on a journey about insulins. Our journey begins in 1921 when two Canadian researchers isolated insulin from bovine pancreas. This was the beginning of the insulin therapy. Only a year later, the ink implants company called Lucius and Brüning in Frankfurt got the privilege to be the first European company to license insulin. The pancreas of slaughtered animals was delivered deep frozen in Frankfurt. To make 100 grams, isolated insulin required about 800 kilograms of raw material. It was a classic natural substance extraction. In 1983, researchers at Hurst developed a biochemical method allowing the production of human insulin from pig insulin. For the first time in the history of diabetes treatment, human identical insulin was made available. The 1990s was the beginning of the year of biotechnological production of insulin. The state-of-the-art plant for producing Lantus, insulin glargine U100, was commissioned in 2000 in Frankfurt. In Frankfurt, there are various facilities for the production of a range of different insulins and sterile pharmaceutical products along with insulin pens. In short, everything right up to the finished product for the patient. Okay, but what is insulin, right? Insulin is a protein, or more precisely, a hormone. It is made up of amino acids that are threaded together in a specific sequence, and which are also in part linked with each other. A glimpse at the three-dimensional structure shows just how complex insulin really is. We have to rebuild exactly this structure. What is the difference between the active ingredient of Lantus, insulin glargine, and human insulin? In Lantus, the long-acting insulin glargine, we have modified the insulin molecule. We have incorporated two additional amino acids and an amino acid changed. By this technique, insulin glargine is soluble at the acidic pH 4. When this slightly acidic solution is injected in the subcutaneous fat tissue that has pH of about 7.4, the protein crystallizes out, back into its crystalline form. The body builds up a store of the active ingredient, which is slowly, little by little, released. Who are the insulin producers? In producing insulin, we have billions of little helpers. They are the pets of molecular biologists. Escherichia coli bacteria, called E. coli. They contribute to have our insulin such as Lantus today. This is because we have genetically modified bacteria so that they produce a precursor of insulin. Although they cannot use this precursor themselves, it does not harm them either. Then, it's our job to extract this precursor, to fold it, cleave it, and purify it. It's a process that requires a lot of time and experience. Okay, how does the process begin? We start with the fermentation, which is the proliferation cultivation of the E. coli. Crucial in this, and it remains our trade secret, are the nutrients and the right temperatures. In other words, everything that improves the well-being of the bacteria in the culture medium and encourages them to reproduce over and over again. After inoculation of the laboratory flask, there is the pre-fermenter. In the fermentation, oxygen is blown through the culture broth and the liquid is stirred and the bacteria are fed with the glucose. After the end of 2 days at high temperature, it is transferred to the harvesting vessel. Then the processing can begin. What do the bacteria make? The bacteria produce a precursor of insulin. This fusion protein is like a pearl necklace on which the individual pearls have been correctly threaded. But to get out this protein, we need to destroy the cell wall of the bacteria. For this, we subject them with extremely high pressure. The bacteria cell walls are unable to withstand this sudden shock and burst. Now the fusion protein is isolated and purified before beginning the folding process. It means that we need to provide the conditions to allow the proteins to take on the correct three-dimensional structure. But there is more to it than that. The superfluous part of that pearl necklace also needs to be removed or cleft. Most of all is this folding and cleaving procedures that are the critical points. They determine the yield and purity of the end product. At this point, we have for the first time insulin. In today's production plants, the picture is determined by stainless steel pipes and boilers. It is one in itself closed process. The plant for the production of insulin glargine is controlled by the employees, roughly 30 per shift. They control the process at the measuring station. They regularly take samples for lab analysis and ensure that the process is running optimally. The production runs around the clock, even on Sundays and public holidays. How do we achieve purities of over 99%? High-level purification of insulin is achieved through multiple steps using chromatographic methods, in which resides the important part of company know-how. Although the chromatographic purification of proteins is in itself an established procedure, it depends on every nut, bolt, and screw. The principle of ion exchange chromatography is based on the fact that proteins, depending on the pH value of the solution, have positive or negative net charge. Accordingly, they either bind to negatively charged or to positively charged materials. By adding salts like sodium chloride, the positively charged proteins become peeled off again, because the sodium ions with the positively charged proteins around bound at the ion exchanger compete. Chromatography can thus be controlled via the pH value and the concentration of the salt. Actually quite simple, but it depends very much on how many parameters the one determines such cleaning sets. At the end of initial chromatographic cleansing, we have an active ingredient with a purity of 90%. After the second purification, that rises towards 99%. By crystallization, the active ingredient is then isolated, recrystallized, and filtered, all under clean room conditions. Subsequently, there is freeze drying, bottling into stainless steel containers, and cold storage. These many steps in production results in an extremely pure white fine crystalline powder. How do you get from the active substance to the medicine? Our active ingredient, as crystalline insulin, is of little use to a patient. Swallowed in a tablet form, it would simply be digested. That's why insulin needs to be injected. For this to happen, the active substance needs to be dissolved in liquid and filled in vials. This needs to be carried out under conditions of the highest sterility. The staff on this high-quality lentils filling line looks a bit like astronauts on the way to the moon. At the end of this production step, for example, we have lentils cartridges, which now only need to be installed in the pens. Where do the insulin pens come from? Since 2007, Frankfurt has a production facility for the manufacture of our in-house developed insulin pens. Our principal product is the SolarStar pen for self-injection, which has been awarded with the Good Design Award. As one of the world's leading healthcare companies, we primarily focus on our patients and their needs. Therefore, we also offer, for example, blood glucose meters. How are the insulin pens made? A disposable pen such as the SolarStar comprises the mechanical dilatant part, the insulin ampule, and the cap. These components are assembled into a finished pen. On the production line, over 6,000 checks per minute are made, involving more than 10 cameras and more than 300 sensors. During final quality testing, the insulin pens are stored in a fully automated high bay warehouse at cold temperatures to preserve the temperature-sensitive insulin. The finished pens are labeled and packed specifically for each of the more than 100 countries which we supply. Delivery takes place in cold containers to reach our patients worldwide in perfect conditions. It's a long way from the bacteria to the finished insulin pen, a journey that requires a lot of expertise, all made possible, first, through the knowledge and experience of our workforce. Here in Frankfurt, there is the research, the development in the Biocenter for Lantus and Toujeo insulin glargine U300, the API production, the production of sterile pharmaceuticals right up to the production of the medical devices, pens and distribution, everything surrounding the topic of diabetes. Here, we research, develop, produce, and market the products, helping to bring health and an improved quality of life to those millions of people affected by diabetes. We shoulder this global responsibility each and every day because health matters.